A short form, a number of health-related questions, a quick shot, and then a vaccine card. That's the standard process when someone gets a COVID-19 vaccine in the US. The vaccination card is a small paper that the health professional fills out by hand. Maryland school teacher Maral Sivaslian got one recently.
She told me I can't lose it. I have to have it, and I have to make sure I take it with me when I get my second dose.
The vaccination card is a reminder that in 3 weeks it's time for the second dose, but also a backup for the nation's electronic record keeping.
So everybody who gets a COVID-19 vaccine in the US, in the state that they're in, that information gets electronically put into the registry.
But Tan says he believes the vaccination certificate can easily be falsified and wants a new system the World Health Organization is considering.
I think there has to be validation. There has to be a way to validate that information, which is why I think having something that is digitally secure, which is what the SMART certificate that WHO is looking at, is needed.
The World Health Organization already has a so-called yellow card, which essentially serves as an official vaccination record needed to enter certain countries. The idea is to do the same for COVID-19 vaccinations. The International Air Transportation Association is suggesting a vaccination app.
Travel Pass is essentially an app which will be designed to be downloaded on a customer's phone, either directly from Apple iOS or Google Play for Android, or through an airline's app. And eventually that would allow a customer to be able to digitally identify themselves.
The International Economic Forum is also working on developing a similar digital passport, an app called Common Pass. It's an IBM platform to store all the medical data.
So in the US, everybody is required to send the vaccination activities to the state. And the state keeps this information into a registry. And what we are working on now is connecting the platform to the registries, so we can also expose that information back to you.
But relying on an app worries human rights activists, who stress that not everyone has a smartphone.
Connecting vaccination with the need to have an expensive smartphone doesn't serve civil liberties or civil rights purposes.
Developers say the apps should be fully functional by the end of 2021. Officials say a lot depends on how fast vaccinations are administered around the world and when countries reopen their borders. Falesia Bakalets in Washington, NRI's VOA News.